Hey everyone, today I want to talk about a really important issue that's affecting all of us on a global scale. The rising rates of cancer. A recent study has sounded the alarm bells. By 2050, cancer cases are expected to increase by a staggering 84.3%, and deaths by 93.2%, compared to 2022. This isn't just a number, it's a wake-up call for urgent action. Let's break down some key findings from this study. First, cancer cases among men are projected to reach around 19 million by 2050, with deaths totaling about 10.5 million. Mesothelioma cases could see a shocking increase of 105.5%. Prostate cancer deaths might surge by 136.4%. Even testicular cancer, which shows a smaller rise, is expected to see incidence rise by 22.7% and deaths by 40%. Lung cancer is set to remain the leading cause of cancer incidence and mortality, with an anticipated increase of over 87%. This isn't just a statistic, it's a devastating reality for millions of families. The study also highlights significant disparities based on age and region. Older adults, those aged 65 and above, are expected to account for nearly 2/3 of cancer cases. And when it comes to the Human Development Index, or HDI, low HDI countries are projected to see a dramatic increase in cancer cases, around 138.6%, and deaths by 141.6%. This contrasts sharply with very high HDI countries, which will experience smaller increases. Now let's shift our focus to India, where the cancer situation is particularly dire. In 2022, India reported over 1.4 million new cancer cases. Interestingly, the incidence was higher among women than men. Breast cancer was the most common, accounting for 13.6% of all cases. Oral cavity cancers are also a major issue, largely due to the widespread use of smokeless tobacco, and cervical cancer. India represented 23% of global cervical cancer deaths, with survival rates significantly lower than those in high-income countries. The Indian government has implemented several initiatives to combat cancer. For instance, certain cancer medications have been exempted from customs duties. There's also a push for HPV vaccinations for girls aged 9-14 to prevent cervical cancer. Plus, national programs aim to enhance awareness and treatment. However, significant challenges remain. Less than 10% of Ayushman Bharat health and wellness centers have conducted screenings for non-communicable diseases, including cancer. Many health centers lack the necessary resources for effective screening and treatment. And there's a shortage of trained healthcare workers skilled in screening methods. In conclusion, the rising incidence of cancer is a critical challenge for global health systems, particularly in countries like India. Addressing these concerns through improved screening practices, enhanced government initiatives, and public awareness campaigns is crucial for mitigating the growing burden of cancer in the coming years. Thanks for watching, and take care.